Chapter 8, Skeletal System, Axial and Appendicular Skeleton, Part 3. So, the vertebral column is made of 24 vertebrae. Here is what a generic vertebra looks like. So, a generic vertebra has an opening called the vertebral foramen. This is what forms the vertebral canal, makes space for the spinal cord to protect it. And that means there's a ring of bone tissue that goes around that opening to form the vertebral foramen. There are 4 different pieces that make up that ring. It includes the body being this big block of bony tissue. So the body helps form part of the vertebral foramen's ring. Then on either side of the body, right and left, is the pedicles. So this area of bone tissue, right and left, is the pedicle. And then the pedicle connects to the lamina. So we have a right and left lamina that connect to each other. And that forms the complete ring. So it goes body, pedicle, lamina, lamina, pedicle, body. That ring of tissue is what forms the vertebral foramen. Here is the partial vertebral column model. Here's the body, here's the vertebral foramen, pedicle on either side, lamina on either side, spinal cord in yellow, spinal nerve in yellow. All right, there's also these processes that stick out from the vertebra. This includes on the right and left sides the transverse processes, right and left, and then sticking out posteriorly the spinous process. And those bumps that you can feel on your middle of your back are actually of the spinous processes of your vertebrae. So again, here is the transverse processes coming out laterally. Here's the spinous processes coming out posteriorly. There's also a superior articular process and an inferior articular process. So if you look at one vertebra, there's a piece of bone sticking up superiorly, another piece sticking down inferiorly, and they form joints with the vertebra below and above. So superior articular process, inferior articular process. The next vertebra, superior articular process, inferior articular process. We, of course, have the intervertebral discs, spinal nerves, and then when 2 vertebrae come together, and only when 2 vertebrae come together, you see this opening for the spinal nerves. That is the intervertebral foramen. The intervertebral discs are actually primarily made of fibrocartilage. There's a denser outer layer called the annulus fibrosus and squishier, more gelatinous inner area called the nucleus pulposus. And it turns out that when someone has a slipped disc or a herniated disc, what happens is there's damage to the outer fibrous layer, allowing the inner gelatinous area to squish out, and then that gelatinous mass can put pressure on a spinal nerve, leading to a pinched nerve and often pain. All right, here are the 7 cervical vertebrae, C1 through C7. Turns out cervical vertebrae all have these extra 2 openings found within their transverse processes called transverse foramen. So there's a right and left transverse foramen in the right and left transverse process. All cervical vertebrae have those. Some cervical vertebrae also have the forked spinous process called a bifid spinous process. So 2 possible identifying characteristics of cervical vertebrae are the transverse foramen and the bifid spinous process. Atlas, or C1, is the first cervical vertebrae. Atlas is the one that makes contact with the occipital condyles of the skull. It obviously, as you can tell by looking at it, looks a bit different. No spinous process. Instead, it has a posterior arch and an anterior arch. There is no body. Instead, it has right and left lateral masses. And then on the top of the lateral masses are smooth areas that are called the superior articular facets that would articulate with the occipital bone. The C2 is also known as the axis. C2 is different from the other cervical vertebrae because it has this piece of bone sticking up superiorly called a dens. And the dens forms a joint in articulation with the atlas, which allows that joint then allows us to be able to turn our head to the right and left to shake our head no. And here you can see the atlas articulating with the axis, forming the atlantoaxial joint, a pivot joint that lets us turn our heads right and left to say no. Thoracic vertebra. There are 12 thoracic vertebrae. Thoracic vertebrae form joints with ribs, so they have these extra facets on the transverse process and on the body where they are forming those joints. So there's a costal facet for the transverse process, a superior costal facet on the body, and an inferior costal demifacet. These are contact points where it makes joints with the ribs. And as you can see here, a rib coming into the thoracic vertebra, the rib actually forms 3 joints and contacts 2 different vertebrae. So here's the rib coming in, contacting 2 different vertebrae, forming 3 joints at the transverse process and the body of the 2 adjacent vertebrae. The 5 lumbar vertebrae are the largest of the vertebrae. That's what distinguishes them. So again, cervical vertebrae have the transverse foramina and potentially the bifid spinous process. Thoracic vertebrae always have the extra facets, and the lumbar vertebrae are big. Then we have the sacrum and the coccyx. Sacrum and coccyx were originally vertebrae that then fused over time. The sacrum has a number of important surface features, including it has its own superior articular processes that form joints with the L5 lumbar vertebra. On its lateral sides, it has this rough area that is the auricular surface. The auricular surface is what makes an attachment with the pelvic girdle, aka the hip bones, aka the os cocci. Looking at the anterior side of the sacrum, you can see these lines known as ridges, the transverse ridges going across the sacrum. That's where the body of the original vertebrae fuse together. The smaller region at the inferior end of the sacrum is the apex. So there's the apex of the sacrum. We also have a broad area called the promontory. That's where the last intervertebral disc lies. We have these openings. These openings are known as the sacral foramina. They allow spinal nerves to pass through. When we flip to the posterior side, we see this ridge running along the middle of the sacrum. That's the median sacral crest, basically made up of the spinous processes of the original vertebrae. There's an opening to what's known as the sacral canal, which is a continuation of the vertebral canal. And then at the inferior end is the final opening known as the sacral hiatus. And spinal nerves travel through that part of the vertebral canal. Thoracic cage. The thoracic cage makes up the chest area. The bony framework consists of the thoracic vertebrae posteriorly, the ribs laterally, and the sternum anteriorly, as well as some important costal cartilage. Functions to protect and house the lungs and heart. Provides attachment for muscles, aids in breathing, and also is the structure that the upper limbs attach to. So there's the clavicles attaching to the thoracic cage. The sternum, at the center of the anterior part of the thoracic cage, is a thin bone that fuses completely by the age of 25 or so. Has 3 regions, the manubrium, superior, the body in the middle, and the xiphoid process, which is inferior. Also has some little depressions, the right and left clavicular notches where the clavicles make contact, and then at the very top is the suprasternal notch. The ribs, there are 24 ribs, 12 on each side. They're called rib 1, rib 2, rib 3, rib 4, rib 5, etc., down to rib 12. So right and left, ribs 1 through ribs 12. The first 7 ribs are the true ribs. They're called true ribs because they attach to costal cartilage that goes directly to the sternum. Ribs 8 through 12 are known as the false ribs. The false ribs either have their costal cartilage attached to the costal cartilage of rib 7, or they don't attach at all. And then finally, ribs 11 and 12 are also known as the floating ribs because, again, they do not attach to the sternum at all. There's the costal cartilage attaching the ribs to the sternum. The edge of the costal cartilage is known as the costal margin. spaces between the ribs are the intercostal spaces. Here is a single rib by itself. You will not have to identify the ribs individually. Just know what a rib looks like. Rib has a long shaft, then it curves, leading to a rough bump known as the tubercle, then a region referred to as the neck, and then finally the head. So the head of the rib and the tubercle of the rib articulates with the vertebrae, thoracic vertebra. So again, here is the facets that articulate with the body of the two adjacent vertebrae. Here is a articular facet on the tubercle that articulates with the transverse process of the vertebra. So again, one rib comes in, contacts two vertebrae, forming three joints. And that is it for this part of the lecture.